If this is your first time, please subscribe. And for those who don't know me, my name is Lorena Loarca. I am a scientist and naturopath specialized in St. Hildegard medicine. Today we have a very special guest, Dr. Michal Kucewicz. Thank you so much for being with us today. Dr. Kucewicz is the founder of the Brain and Mind Electrophysiology Lab at the Gdańsk University of Technology in Poland. He studies the brain mechanisms underlying memory and higher cognitive functions. He earned his degree in neuroscience from the University of Cambridge and completed a PhD at the University of Bristol, and then conducted postdoctoral research at the Mayo Clinic in the United States. I had the blessing of crossing paths with Dr. Kucewicz and his family when we were working at Mayo. He also helped to demonstrate the direct electrical stimulation of the lateral temporal cortex that can improve verbal memory in humans. And his current research develops implantable devices and AI-driven brain-computer interfaces that continuously monitor and stimulate brain activity to treat memory and cognitive disorders. And beyond science, he and his family, they are practicing Catholics, and he leads the Polish mission of the Catholic community Cor et Lumen Christi, combining evangelization with healing and charismatic ministry. So welcome, Dr. Kucewicz.
Thank you for the invitation and a nice introduction.
Okay, so many of us would like to know what is epilepsy and how does it manifest, like in plain terms, in plain English.
Epilepsy is a neurological disorder. So it's a disorder of the brain, specifically the electrical activity of the brain, which somehow gets out of control, if you like. It becomes hyper-synchronized. So it kind of, in simple terms, becomes too active. And this kind of aberrant hypersynchronous activity spreads across the brain, causing being manifested in what we typically associate with epilepsy, which is, convulsions and loss of control of body movements, loss of consciousness that many of us might have experienced, like with someone on the street or in some work situation.
So we can think that a person who has epilepsy has a brain that functions like too much. Is that what we could think?
Or its activity gets out of control. Its spontaneous activity gets out of control.
Okay. So do scientists know what are the causes of epilepsy?
Yes, so there's several causes, and there is not just one epilepsy. There's different types of epilepsy, and some of the causes are kind of almost inborn. There's genetic factors which determine some types of epilepsies. But there's also those that are acquired throughout the life and are related to some trauma, brain trauma, for example, which can also cause epilepsy. So there is a range, I would say, of causes.
Okay, and I guess that the next question would be, does it have a cure?
We do have some pharmacological agents which can control to a certain degree epileptic seizures in more or less 2/3 of the patients. So two out of 3 patients on average can be managed and controlled through drugs. Okay, 1 out of 3 of those patients are so-called drug resistant, which means that they would not respond to standard pharmacological treatment, and they require other interventions, which are more or less effective, I would say.
Okay, and I guess that this is where your research comes, right?
Yes, so most of our research is with this difficult cases of drug-resistant epilepsy, where we try to investigate both the mechanisms of epilepsy itself, but also the so-called comorbidity, so the problems that the patients have with other functions and just quality of life in general associated with their cognition, memory, being able to perform daily activities.
Okay, so can epilepsy affect memory even between seizures?
Yes, so this is very typical of more or less half of the patients with drug-resistant epilepsy, that they would complain about memory functions. So they would forget things that they normally should have remembered, including significant life events. And so it's not every patient, but it's every other patient that would struggle with these functions.
Okay, and I don't know if are they conscious when they are having the seizures?
Yeah, so we're talking here about problems which occur between seizures. So during
Yeah,
seizures, obviously all those functions collapse and you
yeah.
typically lose consciousness. So you cannot really speak about memory functions at this point. So we're
Okay.
talking about the problems which happen between seizures. We call it interictally. So between ictal seizures.
Okay, very interesting. So, why do some people with epilepsy forget things? And is there anything they can do to improve their memory?
So it's still an ongoing area of active research, and there is not just one factor that determines memory problems. And even drugs themselves and the treatments can aggravate some of the symptoms related to memory. So other, most more kind of sensible or obvious reasons are, of course, the aberrant pathological activities in the brain, electrical activities, the brain trauma itself, which caused epilepsy, um, and seizures themselves may also interfere with some mechanisms like memory consolidation and others. So we're trying to dissect what are the exact causes of this and try to develop treatments for those.
And do you think that these kind of memory games, like for children that have cards that people have to know where the pair is, do you think that this type of games can help people with epilepsy to improve their memory skills?
I think it's actually a general question, not only concerning epilepsy, but generally other brain diseases which have memory problems. It's one of the most common questions that I get from patients, like, would playing these games that improve my skills? And my usual answer is, you may improve a specific skill, like solving this particular game, and you can become better at this, but it doesn't mean that your memory in general will become better.
Yeah.
So the obvious answer is that it is not sure that it's going to generalize.
Mhm.
Probably wouldn't hurt you to do these things, but there could be more effective ways of improving your memory than playing a particular game or particular app on your phone, right?
And what about music? Because I know that there is some research about certain types of music, like for example, classical music. Does that have any impact on?
There is a few papers which suggest that certain because epilepsy is a disorder of the rhythms of the brain, okay, and in particular frequency, let's call them brain waves.
Mm-hmm.
There is a theory, let's say a hypothesis, I would say a hypothesis, that music may help tune these brain waves so that they kind of don't come out of control, right? This is a very vague hypothesis, and the mechanisms of this are really difficult to study. Although there are a few papers which suggest that some particular types of classical music, I don't remember exactly, but I think it was Mozart or some other famous composer, are have some kind of effect on the probabilities or incidence of seizures. But the mechanisms of this is very unknown, so I would be very careful with drawing causal relations between the particular types of music or the spectral composition of sounds on the brain activity.
But are there any factors that can induce the frequency of seizures, like for example, stress or some contaminants, for example, smoking or?
No, definitely. So stress is a big factor. There's also circadian, we call them diurnal factors like your rhythms and the moods, the states that you go through every day, which can increase your likelihood of having seizures. So some patients may have more seizures when they go to sleep, for example, or when they wake up, because their brain transitions from one state to another. So these things will definitely play into particular epilepsy and when you would be most likely to have seizures. And stress is, of course, associated with this and is a big factor. So we have seen patients who would pretty regularly get their seizures after we do with them memory tasks in the hospital, because they get so stressed about these that it would, kind of precipitate seizures, if you like. It's not a rule. It doesn't happen with every patient, but it's sometimes we see this. On the other hand, being engaged and engaging your memory functions and your brain seems to have some kind of potential suppressive effect on seizures. So it may inhibit incidence of seizures when you're attending or active cognitively. And we see, for example, less of pathological activities in the brain when you, for example, engage your memory systems. So there is a very complicated, intricate interplay between your kind of cognitive states, your stress level, the level of your hormones probably during your day, and others which would all have effect on your seizures.
Okay. And what about the rules, like in every country, I think are different. But for example, in Europe, is this considered as a disability? Are there any is there any help for these people? Can they work normally like everybody else?
I think we have a general problem of social stigma still with epilepsy. A little bit, maybe not as much as, but a little bit like with psychiatric disorders, that people generally feel socially isolated and don't want to be exposed with their disease. So we see this, that even people who are actually cured from epilepsy, thanks to some interventions, still don't want to be publicly identified as epileptic patients. So it is more difficult for them to to find jobs, to get into relationships, to function normally, which would require some kind of help, right? Social help that you're talking about. And depending on the country, there is more or less of this. I would say that increasing public awareness may be potentially as effective as providing direct help for patients themselves. Because if we are all more aware of this disease, then it becomes more natural and normal for them, and we are understanding of people with situations and more helpful for people in situations like this. In Poland, I'm not aware of particular programs that would engage the public or specific patients like that. There were a few programs like that in the United States. The Epilepsy Foundation was really good at this, and there were a few others. So there's definitely a need, but I think it's not the need is not met with the appropriate aids yet.
Okay. And I have a question about the memory problems. Can we think that memory problems would be like an early warning sign that a seizure is coming?
That's a very interesting question. A question about the causal relationship with cognitive functions and seizures. I think we've got too little data to really speak about this, and it's an active area of research to try to link the two. I think what I can say is that we start appreciating more and more the impact of cognitive comorbidities, cognitive problems in epilepsy that has so far been pretty much neglected. So the number one issue to solve in epilepsy obviously are the seizures themselves, and patients put it as number one for their complaints and factors affecting the quality of life. But surprisingly, cognitive problems, memory problems are among top 3 or 4 in those factors. So we start appreciating it more and start developing interventions which would target also those problems, or at least check if the interventions that we apply for seizures do not interfere with and aggravate cognitive functions. So to answer your question, the link between the two is still unclear, and if there is one, but the appreciation and the research of these functions in epilepsy is increasing.
Okay, and you mentioned that sometimes like the medicine itself can affect their cognitive functions or their memory skills. So how do the patients cope with this? And is there anything that they can do to prevent these effects, secondary effects of the medicines?
Yes. So the first thing is interaction with your neurologist. So your neurologist should be looking for a mix of drugs which would be effective in treating your seizures and at the same time not impairing your memory functions. So there is a possible way to optimize or individualize the choice of your drugs that would work better for you than for others. For me, for example, I'm also suffering from a genetic disorder with cholesterol metabolism, and some of the drugs were just having very bad side effects for my muscle system. So likewise in epilepsy, I changed my drugs and I don't have those side effects. So it is possible to change your drugs to a certain degree to diminish those. But there's also other things that should be taken into consideration when thinking about those cognitive functions. Can you remind me the question? Because I had an idea, but I blanked on it. Maybe you'll be able to cut it later. What was the question?
So how can patients cope with the secondary effects of medications, especially in their cognitive functions and their memory skills? Can they do something to
Right.
prevent?
Yeah, now I remember. Yes, sorry. So, and apart from the drugs, they can actually care for their cognitive functions by, lifestyle changes, diet, nutrition. These are all really big factors in not only in epilepsy, in preventing cognitive decline in other diseases, like preventing neurodegenerative disorders like Alzheimer's or Parkinson's, which can have equal effect or even better effect than any kind of drug prescription. There was a famous Australian study which was showing on a population level that these lifestyle changes and nutrition can have huge effect on your probability of getting those diseases. So that's what I would say. Choose the best mix of medication that works for you, and then care for your brain, change your lifestyle and your nutrition.
Exactly. Yeah. I remember reading a paper. No, it wasn't just one paper, but there were various papers that show a link between poor mastication and some nervous system diseases like Alzheimer. And apparently, there is a connection between the poor mastication, inflammation in the gut, and stress oxidative in the brain that can induce to certain diseases in the nervous system. So what you are saying is really important, because one of um, the suggestions that I give to my patients is that they, like all my patients, that they start by masticating, like spend more time in chewing their food. Like instead of 15 minutes, like everybody does, 15 minutes, spend like 45 minutes, 1 hour in your lunch.
Yeah, so little changes like that,
Yeah.
can have big impact. And the inflammatory states in the brain, they're definitely one of the causal factors, not only in epilepsy, but also in those neurodegenerative diseases, especially, I would say, right?
Yeah, and I believe that the problem is that the brain barrier cannot be crossed easily. Like some antioxidants and medication that would help to reduce the inflammation in the brain cannot really cross that barrier, right?
Yes, yes, but some of them are known. So what I usually
Okay.
recommend, or when I'm asked this question, how can I care for my brain? I give
Mhm.
an example of flavonoids. This is one of the most studied substances that can have huge impact on the inflammatory states, and they cross the blood-brain barrier, especially for the health of the brain. Not all flavonoids. This is a really large group of compounds, but specific flavonoids that affect the brain functions, like those that you can, for example, get from like blueberries,
Okay. Mhm.
or that's what we eat here in Poland anyway. There are very rich
Mhm.
sources of those particular flavonoids. So you have to just find the ones that work for, as you say, that can cross the blood-brain barrier and can be effective for the brain.
This is really interesting. Thank you so much. And I have one more question regarding the what are the most surprising things that scientists have learned about memory from studying epilepsy?
The most surprising things are, I had one case of a patient who you could call a savant, who instead of having a memory deficit, she actually had a memory advantage over general population. And it
Oh,
was probably related to the mechanisms of epilepsy, this hypersynchronization, if you like, which was coming from a particular area of the brain, right? So her seizures were coming from an area of the brain which is responsible for, uh, let's say, word associations,
huh?
okay? And it turned out that when we gave her a task for word association, so remembering pairs of words like, pencil and dragon, or, beach and dog, she was like almost perfect in remembering 300 of them. Like
Oh,
she
wow.
didn't make she just made single mistakes, and they were not really mistakes because she just had too little time. If we gave her like a second or two more, she actually remembered them. So she had a perfect memory for associating words, which was really interesting because we would expect otherwise, that because the seizures were coming from that area, she would be impaired. But it turns out that mechanisms of memory often require synchronization of the brain areas themselves. So sometimes when you've got a little more synchronization, if you like, than other people's have, you may get an advantage out of this. But I would say it's more of an exception rather than a rule.
So maybe there are out there many people who knows, right? Many people with epilepsy with very good memory. Maybe.
Most of them struggle with memory, but there are specific cases where you could have memory advantage. She wasn't aware of this until she made the test with us. And this is a good point with this question about the games and the particular
Yeah.
things, exercises that you can do. Because all her other functions she was complaining about, like, episodic memories, remembering things that she had to learn for school, like some facts. But there was this one function, like associating words, because it was coming from this word association area, which she was perfected, and she wasn't even aware of before the study. So we helped
Wow.
her. It helped her, if anything, build her confidence that she actually
Yeah.
can learn. She just requires a different strategy to use to remember facts by associating, them together, instead of the way we would normally learn things from a handbook. She was a student, so she was struggling with her studies in college.
Wow. I think for me it has been a very interesting interview, very helpful to understand the mechanisms of epilepsy and also the struggles of patients with epilepsy. I'm really grateful for your time. Thank you so much. God bless you. And I would like to ask prayers for all my patients and for Dr. Kucewicz's family. Thank you so much and see you next time.
Thank you so much, and my prayers are with you too.